Dear partners, dear colleagues, dear friends. Well, all good things go by three. And this is why I am particularly excited to be able to welcome you today to our third edition of the virtual meeting series. What a pleasure and honor indeed to have you with us today. Proudly, we are partnering with Sana Technical Assistance Facilities in this important virtual event. So a massive thank you to our long-standing partners and friends at Sanataf and Finance in Motion. And here, in particular, to Elvira Lefting, Elena Matjolius, Maha Okail, and Ole Nestingen. And I'm very happy to be able to say another excellent cooperation. A huge thank you also to the German Emirati Joint Council for Industry and Commerce for their kind support, and here in particular to Oliver Oehms. As you can see, one hand does not clap. Together as partners, we are so happy to see that our GAWBL platform, which we founded to connect, to empower, and to engage with women across Germany, the Arab region, and the international community, is constantly growing. Yes, we're becoming more and more, and this is more important even in times of crisis. Times that remind me of a sentence my granny used to say: without health, everything is nothing. How true. How true, since we have seen in these unprecedented times that health is connected to everything. Now, some of us have lost loved ones to the pandemic. Some of us have lost their jobs, their economic base. Some of us have fought the virus to exhaustion and still do. And so at this point, it is time to say a massive thank you to all those out there who are working tirelessly on the front line to fight against the many different consequences of the pandemic. And surely women are on the front line. Thank you for so much commitment. Thank you for so much resilience. Thank you for continuing, for not giving up, because only together can we emerge from this crisis stronger. Our commitment at GAWBL is to moving forward, taking this crisis as an opportunity for the better, by joining efforts, by joining forces, by strengthening our network, so as to pave the way for future generations together. Clearly, we need to rethink, reframe, and redo how we innovate for the future. And the healthcare sector, in particular, has been proving so far that crises are always opportunities. Perhaps sometimes forced opportunities. Opportunities to dare something new. Opportunities to adapt to new scenarios. Opportunities that should be open to all of us. And this is why I am particularly happy to welcome our wonderful speakers today, coming from all different walks of the healthcare sector. And now in alphabetical order. Dr. Wala Al-Alami, coming from Pfizer. Tom Rooten from Siemens Healthcare. Hanan Saab from PharmaMed. And Yara Abu El-Wafa from Mott MacDonald, whom our great expert and moderator of today's session, Nicole, will introduce to you later in detail. And so it is now my honor and pleasure to welcome our expert and moderator of today's session, Nicole Formica-Schiller. Nicole, you are truly not only a long-standing member of our GAWBL family. To be honest, I couldn't think of a better moderator to share your tremendous expertise, passion, and personal experience in the healthcare sector to guide us through our session today. Nicole, you are global and preeminent expert in artificial intelligence and blockchain, known for your ability to translate complex health trends and disruptive technologies of tomorrow into use cases of today. You are the CEO and founder of Permanicor Health, an innovative global advisory firm. You have been selected by Forbes for most innovative ideas for, and now I quote, writing future codes, and you are the author of the pioneering book, Artificial Intelligence and Blockchain in Healthcare: How COVID-19 and Forward-Looking Technologies are Revolutionizing the Status Quo. Before founding Permanicor Health, you've been working for well-known companies across the world, such as Nord Stream, where you have been working with former Chancellor Gerhard Schröder, Freshfield Bruckhaus Deringer, Allianz, Sherman Sterling, and Munich Re. And this is why I must say I am particularly excited that you will not only lead us through the session as a moderator today, but that you now will also share with us your profound knowledge about this important and innovative topic on how artificial intelligence and blockchain will help shaping the future of healthcare. So looking into this virtual round of concentrated healthcare power and expertise, I'm all the more looking forward to an insightful, inspiring, and engaging session. And as Hippocrates has put it so aptly, health is the greatest of human blessings. So Nicole, the floor is yours.
Thank you, dearest Gabi, for this kind introduction, and thank you for having me at such a valuable event. Hello to our international audience and a warm welcome also from my side. In the next 2 hours, we will dive deep into the topic of women in the health sector navigating the pandemic. We will get first-hand insights, we'll focus on learnings, and share recommendations together with our distinguished guests, whom I will introduce in greater detail following my keynote. When I had been asked to give today's opening words, I did not hesitate long. And that was triggered on the one hand by the remarkable concept of this webinar series. And coincidentally, on the day before, I was asked in an interview by a journalist, what has changed for you because of the pandemic? A question which I get often asked as CEO and founder, not only by government commissions, boards, task forces, etc., that I contribute to. But when the journalist this time asked me that question, I recognized 2 things. Yes, many ask me this question in particular with regard to my expertise in digitalization related to health. So they ask, how can, for example, AI and blockchain contribute to fighting the pandemic? Did COVID-19 truly speed up the digitization? Or what is your opinion on that point, also from a geopolitical point of view? And when AI is really needed as a game changer, as what many people say, what would you, for example, recommend the EU, who is at the moment drafting the upcoming regulation on AI? These are all, as you can see, more technical questions. But not so many people ask me actually specifically what has changed for women in general and in the health sector in particular due to COVID-19. And therefore, I'm very happy to exchange with all of you on that specific topic and on that important topic today. So maybe the next slide, Gabi, that would be much appreciated. So the pandemic has put our global health on the agenda, actually, of the world in seconds. And women are often, we all know this, disproportionately affected. On the other side, we also know that women are playing a really crucial role in responding to COVID-19. If it's as frontline healthcare workers, as caregivers at home, mobilizers in the respective communities, and much more. But not only, but in particular in healthcare, they fight also the pandemic in various different areas and disciplines. For example, as healthcare professionals, in pharma and medtech, as patients, as consumers, as health policymakers, in government, as well as in academia and research. For example, when it comes to the development and the R&D of a COVID-19 vaccine. So next slide, please. And this is something that women have contributed on this kind of a whole value chain, what I just tried to explain in very short words. This is something I get as a feedback from all of the different places where I have worked so far in the world, regardless if that was in London, in Kuala Lumpur, in Moscow, Berlin, Hong Kong, Munich, Zurich, everywhere. Because COVID-19 affects everybody out there. We see this, it's a global pandemic. But in addition, I experience, like many of us do, that COVID-19 has undoubtedly also speed up the digitalization in several parts of the world. You can hear and you can read this everywhere. To give you, for example, an example of Germany, then Germany, the use of telemedicine has massively increased, actually tripled between 2019 to 2020 by almost 45% of people willing and using telemedicine. So, looking back to this, on the one hand, good developments, we already have seen that there was a pandemic out there in 1918. So we can already wonder what has changed in the last 100 years actually since then. For sure, we can say we are more digital, if that is a benefit or a positive side, if you can say so, of this pandemic. But we can also say what has changed since the outbreak of the pandemic, which is now more than 1 year actually. So yes, we are even more digital, at least in some ways. And we also have to recognize that the pandemic, in particular with regard to the healthcare sector, has changed our focus and actually forced us to rethink more towards science, more towards healthcare, women in healthcare, and digital. And in this context, I'm also often asked to get a bit into the technical part, how and can truly AI, for example, or blockchain help fighting the pandemic? So let me give you two short, quick examples. So for example, we can see there are platforms nowadays out there for clinical studies which use AI to match people who are interested and willing to voluntarily participate in clinical studies related to COVID-19. And on these platforms, matched via AI, they can find out if, when, or for which clinical study they would actually qualify. They are also, and this I find also a very interesting use case of voice-enabled AI technology. So with voice-enabled AI technology and vocal biomarkers, there are actually tools and solutions out there with which you can find out if somebody has symptoms related to COVID-19. Or if we come to blockchain, the WHO, for example, together with really major tech companies, have developed a blockchain system on which they transfer data in connection with COVID-19. So you can see these are all examples from the different countries of the world, because everybody, every country, every human being is affected by COVID-19. And COVID-19 does not care where you are from. We know all that. It only cares that we are all humans. So if we go to the next slide, I have to say it is now more important than ever to continue, in particular in healthcare, but also beyond, to connect women and to exchange with regard to the digitalization, with regard to the development of healthcare, because COVID-19 has shown to us that this is very important. The connection can be via business, private, governmental, or any other initiatives. And we also have to say, and this is really truly deep to my heart, we need to see more female role models in and outside the healthcare sector. Because they actually are the real, as I said, role models who show, yes, we are fighting COVID-19 and it is tough. We suffer, we cry, but we all stand up. We fight and we are all in this together, regardless which nationality, which background, which region, etc. We support each other because we share and we care. And this is what I can see very often when I talk to women, in particular, how to fight the pandemic. And the same refers for the digitalization in the health sector and beyond. We all agree that it should not be anymore the thinking in old ways of doing things like we have always done it like this, we will still do it like that. I think COVID-19 has clearly shown that this is not the right approach anymore, in particular also when it comes to improving our healthcare systems. But for this, it's important that we all get a deeper understanding of digital developments, for example, in the area of AI, but also when it comes to blockchain, to robotics, to quantum computing, to the whole, what I would call the digital value chain. Just before, not long before the outbreak of COVID-19, I was invited by the Data Ethics Commission of the German government. And at that time I said, AI doesn't stop at national borders. Who, including me, would have ever thought that this would become true shortly afterwards for a deadly virus? And that would change our whole societies, our economy, and heavily affect our whole healthcare systems. But on the other side, also speed up digitalization. Therefore, when, if not now, using digital innovation in the best way to fit the needs of our society, because society, that's you, that's all of you out there. And therefore, I truly believe in the power of women shaping a post-COVID-19 health sector and beyond through innovation and digitalization. I know after the short keynote to provide you a short overview that there still might be questions unanswered, or even better, which I hope, more questions will come to your mind in the next days. And this is exactly the way we should embrace also as women digital improvements in general, not just, but also when it comes to fight the pandemic, questioning and challenging the digital status quo to improve it day by day. Thanks a lot for the beginning, for your attention. Don't hesitate to reach out to me for questions, ideas, whatsoever. And let's use digital innovation in a way that also, in particular, our future generations can be really proud of us. And now I'm very much looking forward to exchange further with our distinguished guests on the panel. Thank you very much for your attention.
Thank you, Nicole, so much for this valuable insight. We have one question from the audience to you. Anne-Marie is writing, do you think that people are ready to embrace digitalization at its full potential, or is there still some hesitation?
Thank you very much, Anne-Marie. That's a very good question. And I have to say, I can't answer that question in general, because I have to say we see massive differences on from a regional perspective. We see, for example, we know that, for example, in Europe, the data protection aspect is playing a huge role, whereas, for example, in Asia, people are much more going out there using digital tools and so on. So I think what the good side is that actually people have recognized the benefits of the digital tools. You know, for example, coming back to telemedicine, what I said earlier, I mean, you don't need to go physically, theoretically, to your GM. You can actually do it via telemedicine, via teleconference, and he can consult you, which is also very good if you live in a remote area. And just thinking a little bit ahead with the future, this is in some parts, or in many actually still futuristic, but assume the whole value chain, so that actually you get the telemedical consult, you get the electronic receipt, you order it online, and then, as I said, a little bit futuristic, but not too far away, you get the respective pharmaceutical delivered home to you, theoretically in a remote area, by a drone. There are a lot of use cases out there where they already test that. And so I think digitalization, yes, there's still a way to go to answer the question fully, but we are on a very good way. And the improvement which has been done in the last 1 year is really absolutely impressive.
Thank you so much. So then we switch your role now. So you're being the moderator now. Nicole, please.
So as I said, we have a really amazing round of distinguished guests with a very great experience in their respective areas. I want to start first introducing Yara. Yara will start as the first. Yara is the co-founder of Health 0.2 in Egypt, which is an organization to support, in particular, health tech startups in the MENA region through strategic partnerships and knowledge creation. In parallel, she's also a healthcare technical advisor at Mott MacDonald in Dubai. She's a global health professional focusing on digital health and innovation, using the latest advances in technology to redesign health systems. She has held and she's still leading diverse health projects in consulting in the private sector, startups and international organizations. And she holds a master's degree in health services and public health from various international universities. Yara, I'm very much looking forward to the presentation. The floor is yours.
Hi, Nicole. Thank you very much. And thank you very much for inviting me here. And I'm looking forward. So, well, as you were saying, that we're in very exciting times now in the health sector, and especially when it comes to digitalization. So I've been working in the health sector and the digital health in different capacities, shapes and forms and countries for the past 12 years. And I still remember actually when I was doing my thesis and looking for evidence, and at this time we still called it ICT for health, which changed to mHealth, which changed to eHealth, which changed to Health IT, and now we're finally reaching digital health, understanding the full capacity of what could digital do within healthcare. But long before COVID, actually, the health sector was suffering from many challenges. So the rising costs, the increasing patient demands, shortages in medical professionals. And then came COVID to actually uncover all of this with a general sense of dissatisfaction within the medical professionals, but also within the patients receiving care. And it had a massive impact in, of course, on the general populations, on the health, on the economy, on the whole health sector, but with a real devastating impact on hospitals, which is something that I work on a lot now, specifically how to digitalize hospitals. So within the GCC, last year, almost 50% of the regular care provided in hospital was just completely wiped out. More than 8 million fewer patient contacts per week within like the whole GCC. And this had a massive impact on the business models of the hospital, and it created a massive backlog that now everyone is struggling. Okay, what are we going to do with this backlog, and how are we going to treat all of these patients that, you know, their care was just wiped out last year? So before that, digital was kind of interesting and nice to have, and, you know, they were thinking of having it at some point in time with selecting and choosing things here and there at some points. But now with the COVID, digital just become front and center, with everyone saying, okay, what do we do now? How do we solve this? You're saying digital, what can we do with telehealth? And as you were saying, AI became on top of this list. But what we see as the bigger opportunity of just, you know, having telehealth to digitalize that service, or AI supporting like clinical pathways, is, and this is something that is being discussed a lot, specifically after COVID. How do we redesign the whole health system, and how do we rethink the care that is being provided? Working a lot in hospitals, you usually, like the traditional thought that also Gabi was saying, that this is now a time where we re-challenge the traditional thinking. Traditionally, you'd think hospital outwards. So here we put a 200-bed hospital, here we do a 300-bed hospital in this city or something, and then we're thinking about it like what's in the hospital, and then from there you think outward, what can we provide within like the community or the city that we live in. But with what's happening in COVID and all like the social distancing regulations, and also understanding and the availability of technologies to have more care that is being provided within the community and closer to home, we're now rethinking the whole healthcare system on what is being able to be provided within the community closer to home, and then what is left that could be provided in the hospital. And this is definitely, as you were saying, is being done through telehealth, through AI, sensors, wearables, that is now providing more the health professionals of doing the possibility of like remote monitoring and providing much more services outside. And this is having like a massive impact on the physical and virtual design of the hospital. And also, interestingly, now we're working on some projects where specifically in the UK, they're saying, okay, before you build a hospital, you don't just build a hospital and then think, okay, what digital solutions can we just put on top of that? But how can you think from the very beginning how the digital technologies could affect the whole built environment of the hospital and the care that is being provided then. But overall, I think we're still in the very beginning of the journey, but it's quite interesting.
Thanks a lot, Yara. That was really great insights and much appreciated. And we will get back to the certain points which you already raised later at our joint panel discussion with all our other panelists. So for the time being, I would like to introduce you to our second panelist and honored guest, which is Dr. Wala Al-Alami. She is the Vice President and Cluster Lead for Egypt, Levant, Iraq, Iran at Pfizer Biopharmaceutical Group. She works closely with both public and private organizations around policies and strategies to achieve healthcare priorities in various fields, like vaccines, rare diseases, oncology, inflammation, communicable and non-communicable diseases, and other type of, in particular, local or regional healthcare priorities. In her previous roles at Pfizer, she was the regional lead for oncology in Africa and in the Middle East. She started her career at Novartis in France, and she holds a doctorate of pharmacy and a master's degree in business management and health economics. She's also, on top to all of that, a passionate advocate for diversity and inclusion with a special focus on advancing women in leadership. She sits on the boards, for example, of the Arab International Women's Forum and a number of other key regional organizations. She's joining us today from Dubai, so Wala, the floor is yours.
Thank you, Nicole. And it's really a great pleasure to be with you all today. Good afternoon, good morning, depending on where you are. I think I wanted to build a bit on what you said, Nicole. I will not be talking much about digital yet. I think it has been covered quite nicely, and I'm sure we'll have opportunities to discuss more in the Q&A session. But what I wanted to focus on more, and you started nicely speaking about it, is really the role of women in the pandemic and vice versa, the impact of the pandemic on women, and we can take it from there to the vaccine. So, as you rightfully mentioned, COVID obviously has put women, employees, entrepreneurs, consumers at the front line. So across every single sphere, from health to economy, from social, to social protection, we've seen a massive impact of COVID on women. And so you've mentioned nicely, Nicole, the role that women played, in the front line. And I think you alluded also to the role and how they've been pressurized in the front line at home. So we can start with that. I think the lockdown had a massive impact on women, and I wanted to really refer on, I'm sure something you have seen, that had a recent survey that was done by LinkedIn and published in the UAE right before International Women's Day, that showed that 56% of women, and I know the data is very much similar across the globe, have seen their workload, increasing at home, and the responsibilities significantly increase, in addition to everything else that they had, to juggle with. So that's in the front line at home. You've mentioned also the extraordinary role that we've seen women play. We've seen the spotlights on women. This is not new. Women have been representing more than 70% of the workforce across the globe. When it comes to healthcare, sector, we have a majority, 70% across the globe, serving and giving care to more than 5 billion, people that we have on the planet. So these are all, I would say, the pressure that we've seen being, that women have been facing with with the pandemic. But we've also seen, to your point, in your keynote, women being a big force in the pandemic. So we've seen it across the globe, at the political sphere, but also, in the field of research and development. When it comes to vaccine, women have played a tremendous role in contributing to bring an end to the pandemic. And if we were to speak about what you mentioned, which is the vaccine, and I can cover part of it, the various vaccines that have been developed in different parts of the world, regardless from who the manufacturer is or where they were developed, have seen women playing a tremendous role in the research and development, but also in the rollout of all the vaccine, across the globe that we see now being, rolled out in the various vaccination campaigns. So if we bring it to the world that I know, but as I mentioned, I could give you also examples from all manufacturers, be it in the UK, in India, or Russia. Yeah, in Pfizer, the head of the vaccine R&D is a woman. And the head of the vaccine business at the global level is a woman. The co-founder of BioNTech, Gabi, you're familiar with that, as BioNTech is German-based, is a woman. And the head of the vaccine mRNA platform in BioNTech, is a woman. So I think it is great to see that wherever we look into that race that we've seen across the globe in bringing a solution to end the pandemic, women have been playing a tremendous role. And I think the question that we have to ask ourselves is this a surprise, right? Is this news? The reality is it's not, right? So as I mentioned, in the healthcare sector, I spoke about the services and nurses, medical doctors, we have 70% representation. In the healthcare sector overall, we have 60% women, right? When you look at the universities, the representation of women is very similar. And this is where I think we want to go back to the importance of ensuring that we continue advance on our diversity and inclusion discussion, on the role that we want to see women playing in leadership roles, because I think the pandemic has really shown that whatever we had critical crisis management situation that we had to face, women were instrumental, in bringing a solution to the pandemic. And we need to link it to the reality where we are today. So while we speak about 60% of women in the healthcare sector, and in the universities, we only have 23% in the board of directors. We only have 13% in CEOs roles. And I think it's really a call out. I think a call out for all of us, while we continue to fight the pandemic, while there is so much focus on all the problematics that the pandemic has, put on all of us to solve. We shouldn't, lose focus from continuing to advocate, continuing to focus on women empowerment, especially in the healthcare, because we have seen the impact and the role that they have played, in the pandemic. So that will be, in a way, Nicole, my call for action based on, the experience and what we see has been done by women in the fight on the pandemic.
Thanks a lot, Wala. You raised some really valuable points, which I for sure will get back onto later. So let me introduce you now, Hannah.
Nicole, one question. Sorry to interrupt you, but we have some interesting question coming from Bettina, because we have many ways that the question come in. So one question is to Dr. Wala. How did you work to ensure the rollout of vaccine under corona conditions so quickly and safely, especially remote working, which impact on your leadership? Agile leadership. So how would you describe that? That question is coming from Bettina.
Well, it's an incredible question. I'm sure, Bettina, we might need more than 2 hours to address those, but I will tell you, the key learning, of course, there has been an incredible, team at Pfizer. But again, as I'm speaking today, Pfizer, I'm sure if we were to bring any other manufacturer of vaccine, they will be sharing, kind of their learning as well. But what we've seen, at Pfizer, what has been done in an unprecedented way, because of the unprecedented nature of the COVID vaccine, vaccines usually take between 10 to 15 years to be developed. And I think this is where, the extraordinary achievement that vaccines manufacturers like Pfizer and BioNTech have done, is really to move from, stepwise sequential work that we usually do into more integrated and parallel processes. To accelerate the research and development, from research development to manufacture. I think the key element that was, important in changing the way we work while, dealing with the pandemic was this, first of all, taking bold decisions. And I need to recognize all the leaders, that decided to, invest massively into the development of the vaccine against all odds, because we were only talking about this less than a year ago. Changing the way we work definitely is a key learning, as I mentioned, from sequential into parallel work stream. All this bringing into perspective new ways of ensuring that while we're doing all this, we continue, ensure the efficacy, safety, and security of the vaccine, which has always been essential. The way you lead, and I can, see from what I have seen being done at the leadership level, but also, at our level changes completely. So you see, I think, Nicole, you alluded to it, which is can't be done was not an option. And I think everyone that had that mindset of solution finding, of not being afraid of, entering an arena where there is no done before and where you have to reinvent, that agility actually, brought forward some team members that were not, definitely, being involved in past. So the selection of people that had the expertise of vaccine, but also the mindset and leadership, agility to be able to think out of the box was, essential. The type of partnership that has happened, both internally, but also externally was essential in terms of, bringing all the teams together, ensuring that there is no silo, a very clear collaboration, a very early engagement with external stakeholders to keep them in all transparency updated with the progress that is being made on the vaccine. I think there are so many, learnings that can be shared on how we work, on how leadership needed to be reimagined the same way work needed to be reimagined. And we also need to recognize, the effort that has been done by government, etc., to partner with the pharma industry and see how we can accelerate the launch of a vaccine that is still efficacious and safe and secure for the population. So a lot of learning, but if I were to highlight only 5, that would be those that I have shared.
Good, thanks a lot, Wala. Really interesting points, and I will for sure get back to, in particular, also the point which you mentioned with the silos, because this is a very, very important topic, which we also see when it comes to digitalization in healthcare. We can't keep on going with silo thinking. This does not work. It has to be interdisciplinary, and we have all work together and cooperate. So now to our next guest, now to Hanan. When I said earlier, we will today dive deep into the topic of women and health, I didn't promise you too much. With Hanan, we have a hands-on expert here on stage who will tell us more about the good, but also the really tough parts around the COVID-19 situation in and beyond in her region. Hannah is the owner of PharmaMed Lebanon, which is the exclusive representative of several really renowned European and American firms. And through an extensive network of sub-distributors, it has expanded actually its activities to Jordan, Tunisia, Algeria, Saudi Arabia, Qatar, Oman, and others. She is very passionate about women in business, and she is actually an exemplary entrepreneur herself. Therefore, she has been invited to speak on a lot of international panels on women entrepreneurship across the world, including the World Bank, the OECD, The Economist, and many more. She was on top featured as a leading Arab businesswoman by the Financial Times, and she was listed as one of the most powerful 200 women in the Arab world by Forbes. She's also a founding member and former president of the Lebanese League for Women in Business, and she's a founder and board member of the MENA Business Women Network. She's also a member of the Lebanese Order of Pharmacy and the Lebanese Pharmaceutical Importers Association. On top of all of that, she became a member of the board of trustees of the Academic University for Nonviolence and Human Rights just recently. And for those who now wonder, what did Hanan actually study? What is her background? On top to all of that, she graduated from the American University of Beirut with distinction. So Hanan, we're very happy to have you here. The floor is yours.
Thank you very much for this introduction, and thank you for inviting me to participate in this panel among the very interesting panelists. I'm going to talk about Lebanon currently, which I'm sure some of you have, it has been in the news for some time, so I'd rather reflect on it. Lebanon has been for some time reputable in the Middle East and North Africa region for the level of its healthcare services. In January 2019, according to Bloomberg Health Efficiency Index, Lebanon has been rated 23rd in the world for the level of its healthcare efficiency. Unfortunately, in 2019, October 2019, its economy, which has been dollarized for over 30 years, plunged into a financial crisis, which precipitated progressive failures, affecting the banking system and the exchange rate of the local currency to the USD. This initiated a downgrade rating by the international credit rating agencies. Consequently, the Central Bank of Lebanon, known as BDL, initiated restrictions on the outward transfer of funds and resorted to creating subsidy on essential items such as medications, gas, oil, and food, while maintaining the price of the medications pegged to the long fixed rate to the USD. The measures exercised by BDL and the banking system in the validation and the implementation of the subsidy were tedious in controlling the documents and resulted in restrictions to avail local and foreign currency in cash for the provisions of letters of credits and transfer to foreign suppliers. The spread of the pandemic in Lebanon further exacerbated the process. In imposing lockdown in the country, the availability of personnel at both the banks and BDL was restricted to a minimum, which made it difficult for local distributors to pay in a timely manner the dues to the foreign suppliers. On the other hand, the spread of the pandemic in the exporting foreign countries prompted local health authorities to impose restrictions on the exportation of vital items, where priority was allocated to the local population. All of this resulted in a dire shortage of medications, medical supplies, and equipment that are needed for patients in general, including the COVID-19 patients in the hospital setting, particularly the intensive care units. Another important difficulty that hospitals had difficulties all along in settling their dues to us as distributors due to their accumulated dues with all government sectors. In the meantime, the massive explosion in Beirut port on August 4th was the icing on the cake. This resulted in the killing of over 200 people and over 6,000 injuries. The explosion knocked out 3 hospitals in Beirut and damaged many other healthcare facilities, also resulting in hospitals being packed with victims of the explosion as well as the corona patients. On the healthcare distributor end, some distributors decided to lay off their employees and close, considering the incurred losses. We at PharmaMed were impacted by the blast. but luckily without loss of lives. And as hard as it was, resorted to downsizing of our staff and took the decision to sustain our operations and support our remaining employees, consisting of 60% women, for as long as we can afford to do so. Since the outbreak of COVID-19, the HR policies at PharmaMed were set in compliance with international guidelines for safety measures. The IT system, being cloud-based, allowed employees to work from home, while working remotely allowed our women employees to work with more flexibility. It also posed challenges because of the over-reliance on women for childcare and the need for homeschooling. Attendance to the office was restricted to necessity and in coordination with HR to avoid overcrowding. Meetings were conducted via Microsoft Teams and Zoom. Sales and marketing teams carried their activities whenever they could do so, while warehouse teams were always on the ground attending to market needs. This allowed the sustainability of our operations. But despite all these measures, some employees contracted corona. Measures in these specific departments were executed to shift workload to avoid any disruption in the workflow. Over the years, luckily, PharmaMed management and staff established good relationship with the Ministry of Health and the customer base. This facilitated the proper management of the supply of critical products that were needed also to corona due to delay in delivery from the supplier's side. It's really unfortunate that today the deterioration in the economy resulted in the collapse of the financial system, to the extent that $1 equals 15,000 Lebanese liras versus 1,500 at the beginning of the crisis. As a result, the Lebanese population, known for its resiliency, is going through an unprecedented crisis, affecting its survival and existence. So, for how long can the Lebanese population withstand this agony because of the complete lack of action on the part of its corrupt politicians? Only time will tell. Thank you.
Thank you very much, Hanan. That was very interesting and very deep insights. I don't know, Gabi, are there any questions from the audience?
Yes, there are. So let me read it. It comes from Suzanne. She's asking Hanan, how can safe and comprehensive supply of medicines to the population be achieved, not only in what you described, the times of crisis, but in a region where basically all structures coming from the state are a complete failure? How do you organize? How do you really do on the ground?
Well, actually, definitely we are envisioning this, and we are working very closely with the Lebanese Syndicate for Importers. This remains our main target and objective. We are working very closely with our suppliers who are actually understanding the current situation and understanding the difficulties that we are having. We are maintaining as much as possible our operations. And for this, I would like to mention that when the Pfizer vaccines came over to Lebanon, the syndicate of the importers has actually, they took it on themselves to actually distribute them in a safe manner because it was supposed to be stored at -70 degrees. So this is a continuous challenge. And unfortunately, with everyday changes that we are facing, and we are trying as much as possible to allow the safe delivery of these medications to the different parts of Lebanon, despite the challenges that are that we are facing.
So there is from Aida in the chat, thank you so much, Mrs. Hanan. And another question comes from Anne-Marie. The video is certainly still very open to help if necessary. We are much aware of your problems. So the VDU is the Association of German Female Entrepreneurs.
Okay, good to know. Thank you.
Okay. Thanks a lot. I think there are, for the time being, no more questions, Gabi, from the audience. I'm sure they will come later. Perfect. So let's move on to Tom. Last but not least, Tom Rooten. He is the head of Enterprise Service, Market Development Europe, Middle East and Africa from Siemens Healthcare. Tom has been in leadership positions across multiple countries and in business lines within Siemens, including IT, energy, transportation, and others. And he was based more than 10 years in the Middle East. In 2012, he joined actually the healthcare unit of Siemens in Dubai, before moving back to Europe last year, where he is now based in Erlangen, Germany, which is, for those who are not familiar with that region, the northern part of Bavaria. Tom, we are very much looking forward to your presentation, to your input, and to your slides. The floor is yours. Thank you.
Thank you very much, and thank you for inviting me for this interesting panel discussion. And I'm pleased to give some view from our side, how we see the pandemic, what the impact is, the challenges our customers have, and also what that brings to us in terms of different demands from customers. I heard already quite a lot of interesting topics that I partially will also address, which makes it also consistent. But if we can go to the next slide, I would like to share a few of the challenges our customers have. We all saw that in this pandemic that the healthcare system was vital and critical, and in some cases it could not sustain the amount of COVID patients that came into the hospitals, and even led in many countries to lockdowns to relieve that a bit. At the same time, hospitals overloaded with COVID patients, the selective procedures were stopped. And that is for many of the hospitals, or actually all of the hospitals, one of the important sources of revenue. So we saw that many of our customers had huge financial challenges to keep up the hospitals. However, it's so vital and important, but they had challenges paying their bills as well. It was mentioned a few times already, the digitalization. We all know that healthcare is a bit of a traditional sector where these kind of new developments do not really implement or are not fast implemented into working conditions, into clinical fields, and take typically a long time. In the last year, we saw a lot of these technologies, which were actually already long available, but all of a sudden being implemented. Telehealth, patients were not allowed to come into the hospitals, they had to do remote consulting. As I said, these kind of technologies were available already for quite a period, but all of a sudden they have been implemented. And that is, of course, a huge impact on hospitals, that they now need to merge a kind of an ecosystem, not only having patients inside their hospitals, but also outside from home, or maybe from outpatient clinics that they needed to treat. So they had to simplify workflows that were already complex, that even became more complex, and then they need to adapt their workflows within the hospitals to make sure that COVID and non-COVID patients were not interacting, and avoiding to have more outbreak of the new virus, and therefore also they needed to adapt their setups, and we've been seeing these kind of challenges from our hospitals and then healthcare providers, and they're coming now to us, Healthineers, asking for solutions for this, and helping them to change this. And if you go to the next slide, I would simply like to introduce our organization a bit, but not in too much detail, but simply showing the top three blocks there, which is basically our portfolio, focusing on imaging. And there, especially last year, there was a huge demand for additional CTs, X-ray units, ultrasound units, but also the lab diagnostics in the middle, where especially the testing and now also the fast antigen testing created a huge demand for us, and also challenges on our side to keep up with that demand. And on the right side is the advanced therapy, especially there also in cath labs and surgery, where now also new technologies of robotics become more of essence. This can done be remotely. This can also optimize processes, reduce the number of mistakes, and be more precise. So that is our portfolio that we had already for a long time, but due to the pandemic, I would say, there is even a more stronger focus on topics like artificial intelligence, doing less with more. So if you have artificial intelligence in place, they can help you identify certain lesions. They can also support and prepare certain image readings when doctors potentially are not available or working from home. Another element which we call virtual cockpits is a tool that again has been available for a while, but it's something that you can operate our scanners, CTs or MRs. You can operate them remotely, so you can even operate them from home. So people in a quarantine situation could now still operate their machines where patients are in the machine. You still need, of course, the patient to be in the machine, but the staff does not need to be there. And all of a sudden, these kind of solutions were requested by customers a lot more. And as mentioned already, and that is an element that is also where I'm responsible for, is these long-term partnerships, what we call enterprise services, where customers do not simply look at buying an equipment, but look into long-term technology partnerships. How can we help them leveraging the equipment in a better way, leveraging the staff in a better way, focusing on patient experience, optimizing workflows, bringing in the whole digitalization. As said already, this is a sector that is not that high tech in terms of digitalization, and therefore also hospitals need to be supported while doing that. If we go to the next slide, I give some examples of some technologies that we've seen be used a lot. It was mentioned already, virtual visit, having patients at home, doctors potentially also from home, but then utilizing the tools to do it in a digital way. Also avoiding patients to come into the hospitals, and if they have to come in there, as short as possible. So kind of virtual waiting rooms. Patients were sitting outside in the car and waiting to get an alert via their WhatsApp or via the smartphones, the right time to come into the hospital, avoiding to get in contact with affected patients potentially, or with other people, and keeping the distance. So these kind of simple tools, and you can click to the next. This is in, let's say, in the initial stage of the triage, but also clinical operation. Remote scanning assistance, I mentioned it just now already, virtual cockpit, it's called in our world, that you can do this across hundreds of kilometers, so you don't need to go into the facility. Clinicians, they could also not see each other that intensely anymore. They had to keep the distances, and therefore they did not have their weekly meetings or daily meetings with multiple people in the same room. So they also needed to have tools to share communication and to share data in a secure way. So new kind of WhatsApp for doctors and healthcare providers were developed or were implemented and being utilized in a lot more intense way. Next part of this slide, please. As said already, it became more a kind of an ecosystem, patients not only in hospitals, but also from home or from outpatient settings. But at the same time, all the data that was available and needs to be available for certain patients needed to be connected, needed to be shared. And again, these are things that we have been implementing for years, but all of a sudden, since last year, and I think one of my previous speakers also mentioned the statistics there, the number of digitalization there and the number of data that has been processed increased tremendously. Patient monitoring remotely. We have solutions that heart patients, for instance, who had a operation after going home were still monitored. So they can, from home, use wearables or go on a weighing scale or utilize blood pressure measurements. And that's now automatically being monitored. And if certain criteria or certain values are going up, the hospital is automatically being notified of this and can proactively inform the patient that something might be wrong. He might come into the hospital, or a doctor has to be sent to the patient at home. So as I said, you get a kind of an ecosystem that needs to be very well connected, of course, in a safe way, and digitalization makes that all happen. If we go to the next slide, I think it's even my final slide, a strong focus on patient experience. We know that everybody these days is using Dr. Google, finding out what certain conditions or symptoms could be. But that's also, we see that now, and digitalization helps there a lot, that we need to design the hospitals or the ecosystem for that matter in a more patient-friendly way, in a more comfortable way, a pleasant way. People don't like to be, of course, in hospitals, but if they are there, how can we optimize that? And COVID and the pandemic here tremendously improved or accelerated the speed when using these kind of data. And we see that hospitals are a lot more open, and previously they were asking us, can we buy an MR or a CT? And now they're looking into these long-term partnership models with us, where we can help them, where the equipment itself is a kind of an enabler, but everything around it, and training, education, keeping the patient satisfied, keeping the staff satisfied. On the left side, you also see virtual reality, remote training, virtual training. These kind of tools became a lot more evident during the pandemic, and I believe this is a sustainable direction. I think also within healthcare, digitalization became now something like here to stay. It's not only nice to have anymore, but it's a must have, and therefore also going forward, I believe that this is a demand that continues. And I'm happy to participate in the panel now. Thank you.
Thanks a lot, Tom. Much appreciated. You touched some very interesting point, like, for example, the virtual reality topic and the remote part, you know, which came up today already several times. So I'm really happy to dig into that topic later during the panel discussion a bit more deeper. But for the time being, Gabi, do we have any questions from the audience?
So as for now, we do not have a question, but we do have a poll, because there's been a lot of talk about digitalization and how people are really embracing that. So we have a quick poll. This is just one question, very simple, yes, no, no opinion. So I will be sharing the poll right now, and our participants, so start it now, should be able to see it now. And just give your opinion. Corona has pushed digitalization in the health sector enormously. Will this trend continue after Corona? That's truly exciting. So now, okay, I close it, and let's have a look at the results. Wow, 88% saying yes, 13% not sure. Nicole, does it surprise you?
No, honest answer. Yes, I mean, we will get back to that topic in particular at the panel discussion, and then Tom can actually answer then also this question, which he couldn't answer now on the poll, unfortunately. But yeah, it's great to see that result. It's very interesting.
Okay, so that was that. Shall we now have the panel discussion?
Yes, so now we will move on, as Gabi said, to the panel discussion, and I'm very, very much looking forward to a vivid exchange with our distinguished guests, but also with you as the audience. We really encourage you to raise questions and to contribute. Having all these experts here on the panel, I would like to start with the first question. We have touched some topics already, so we are all aligned that the current COVID-19 pandemic has caused challenges which none of us was ever approached with before. And there are also specific challenges. Some of you have already touched them during your presentations, but I would like to get back to that and would like to ask you, what were the specific challenges you have seen yourself confronted with in particular at that moment in that country, in this situation, and how did you manage them? And do you have best practice examples? I would like to start with Walla. I mean, we know you're currently based in Dubai with Pfizer, and we know that there are lots of women in senior positions at Pfizer, including you. And we can imagine, and you already touched it, that the rollout of the vaccine was a specific challenge. So I think what would be interesting also for our audience, what you already touched a little bit, was if you can tell us a bit more how in particular women were involved, and maybe how even agile leadership and kind of new procedures and structures played a role, and what was your experience and the experience of Pfizer with that?
Thank you. Thank you for the question. I think it's a broad one. I would say, so Nicole, guide me to the areas that you would like me to focus on, more, because there's so many things. I think like in all fields, it's almost that we had to pause and really rethink about all areas, that we have to work on. So I think I will cover some of them, and if you want to deep dive in one in particular, feel free to do so. I think there are the common things that all industries had to deal with, which is working from home, and supporting people. And I think that was at the beginning pretty much the same for men and women, adjusting to the new norm, and having the confidence that actually the new norm was viable. And I believe at the beginning there has been a lot of work done. I think we were similar to many others, big on driving change, and ensuring that people can adjust to change. And for the first time, I think in our lifetime, or at least the one that I remember, change had to happen overnight. So we didn't have that luxury of time, to take people gradually through change. So everything that that had to do with having this, the way to interact with customers. So a lot of the work has been done on digital. And on driving change, first of all, internally, to drive the belief that what used to be done face-to-face could be done digitally. And a lot of the work, on driving change, the agility in the mindset, ensuring that we have the infrastructure in place across the world, was essential. I think the second thing that was big, and I believe Hanan alluded to it in a way, and I think maybe I should have addressed it at the beginning, because that was really the main focus for us, was to ensure that we are able to continue supply our drug and medicine at a time where, the entire world, and that's before even the vaccine, all the pharma, manufacturer, Hanan is very much aware of that. We have a lot of the essential medicine that saw an increase in terms of need. So we had to really go back and ramp up the supply and manufacturing in order to be able to meet the global demand that surged, quickly. So a lot of the work had to be done, in the manufacturing colleagues, etc., looking into new processes to accelerate, the manufacturing process to be able to meet the demand. I think Hanan alluded also to the fact that patients needed to continue access, and I think Nicole and Tom also spoke about it. Over time, you had hospitals that were, dedicated to COVID, but, the entire world continued as is. So you had all other non-COVID patients that actually needed, to have access to their doctor or to have access to their medicine. So this is where, a lot of the work had to be done with agile teams, etc., to rethink about how we deliver and ensure that patients had access, to medicine. And I can tell you, in a country like Lebanon that I cover, despite the economic challenges, I think Hanan heard me say this before, I'm always impressed about, the efforts that were done in Lebanon, like others, but I think Hanan spoke about this, so I want to build on her comment on the efforts that were done to ensure that patients continue to have access, to the medicine. So I can continue on and on, Nicole. I would like you to tell me if there are any specific areas that you'd like me to focus on more, and if you want me to, shed some light on the vaccine, or I would be happy to come back, to it. But yeah.
Thanks a lot, Warren. You touched some really valuable points, and would like to get back to the vaccine topic in a second.
Sure.
You actually mentioned Hanan, and I would like to bring Hanan here into the conversation, because Hanan, as you mentioned earlier, pharmaceutical supply chain, one of the big topics for you. It would, I think, be very interesting for our audience if you could give also some day-to-day examples, some experiences where you have been approached by people, maybe even on the street, and they said, we need this and this pharmaceutical. Can you help us? We can't get it. You know, what were your experiences there, and maybe also what was best practice examples?
Yes, actually, number of incidents happen on the people because of the financial crisis. They were really scared. So people used to, for one thing, store medications because they are really afraid that with the deterioration in the financial sector that they might not be capable of affording any more medications. So this really drove the shortage on the market in certain cases. Now, I recall one of my friends wanted to get her mother has cancer and she wanted to get medications we couldn't find in Lebanon. So I managed to call a friend to deliver it in Dubai for someone who was coming to Lebanon. Another actually incident that impacted me, it was on a Sunday, and I received a call from a lady who I don't know. I mean, this being in the pharma sector, people took the initiative to really give my number probably and to other colleagues for trying to secure medications for them. So this lady calls me up because a contact provided her the phone number, and she said that her niece has delivered in one of the hospitals and she has corona and she was admitted to the intensive care. And unfortunately, the hospital at that time didn't have an antibiotic, which was really essential for her and was prescribed by the doctor. And she found out that we actually provide this antibiotic. So what happened was I called up the warehouse manager who was 1.5 hours away from the company. And he managed to, it was a Sunday, so he managed to come down to Beirut, open the warehouse and supply the medication. So, I mean, this is one of so many incidents that, that happened, not only to me, I'm sure to other colleagues. So we're all there. I mean, what is remarkable in Lebanon is that despite the failure of the public sector, the private sector, as always, have been joining hands in order to really support each other. This is what happened pursuant to the blast that took place in Beirut port, where people went down and actually started removing the glass and helping other people to go to hospitals. I mean, Lebanon somehow provides you with a picture which is quite different from other places, whether in Europe or the Middle East, because of the many challenges that we are facing and unprecedented, really. So these are, I mean, some of the examples that we faced.
Thanks a lot, Hanan. This is really very, as I promised the audience before, it's a really deep insights, and I mean, these are really serious and also emotional examples which we can hear from Hanan. So I would also like to bring Yara here into the game. I mean, Yara, as I said at the beginning, you wear many different hats, you know. So one is that you are the co-founder of this organization which supports startups in the health tech sector with a focus on Egypt. So could you see from that perspective also challenges which, you know, as an audience, we might not even be aware of, where you said, yes, this was really big issues, or these were challenges we never had before?
Yara and Nicole, sorry for interrupting. I don't want to be rude.
Yeah.
I just
please
learned
go ahead.
from Dr. Walla that she has an urgent call and she needs to leave us. So I wanted just to say a massive thank you for having you with us. I know sometimes unpredictable things happened, but I didn't want you just to disappear from the screen like that. So this is why I really want to take the opportunity to thank you so much for your valuable insight you've just shared with us. And we stay in touch, and thank you so much.
Thank you, Gabby. Thank you, Nicole, and all the panelists. I would have loved to stay longer, but it was a great discussion. I had the honor to be with you today. Thank you very much, everyone. Bye-bye.
Bye-bye, Walla, and thank you so much.
Thank you.
Bye.
Thank you. Bye.
So sorry, Nicole. Sorry, Yara. The
Sorry, Nicole, as well.
That was an emergency, so to say.
We are flexible, you know.
I know. Thank you.
So Yara, if I may still hand the question over to you.
Yeah, sorry, can you repeat the question again, please?
Yes, so the question was like, you know, you wear many different hats, you know, and one is that you are the co-founder of the organization that supports the startups in health tech with a special focus on Egypt. Were there, from their perspective, new challenges or challenges and circumstances which you have never had to handle before and which you could see in particular, you know, younger companies, startups have to deal with due to Corona in this whole environment?
Yeah, I think the first thing that comes to my mind now, and I remember happening like it was exactly like this time last year around April, is that startups were having this urge on like, okay, what do we do now? We have these solutions, we have these opportunities, you know, we were working a bit, but now as the opportunity is there and, you know, the need is there. And because like there wasn't at the beginning an organized sense of how do you respond collectively to COVID in Egypt, everyone was taking it upon themselves on, okay, what do we do? We have this solution that we can put forward and we're not sure what do we do. And I remember we were trying to organize collectively how do you have like a lineup of startups together who can form some sort of continuity in the services that are now being disrupted, but it raised a much further issue on how in times of crisis do you organize a collective response. So there was some sorts of a collective response, of course, within the different ministries, but as you have very different players who are of equal importance, which are the startups are now within the health scene, how do you actually, what are the sorts of mechanisms that you can loop them in within these sorts of discussions? And yeah, since then we've been trying to engage within wider discussions with the pharma sector, with the government, with the hospitals on coordinating this sort of response. But I think also another thing that comes to mind, and I think it's a very important issue to raise, which is the women's health startups. With the COVID, of course, a lot of people needed to pivot. And with that, also investors were kind of confused. Okay, so what do we do now? What do we invest in? And with that, women's health startups, which looks at, you know, like period trackers, breast cancer screening, and a lot of other things, kind of went down in the priority space when it comes to investments, especially in this region. And it's still within this discussion, and I think it's very important as well to keep in mind this women's health space, that it does not lose priority when we're in COVID response.
Yeah, it's a very good point you raised, Yara, in particular the women-related health tech startups, and also then from an investor perspective, because the points you have just mentioned, really many, I know from the environment, also many women actually with their health tech startups actually have to handle and deal with at the moment under specific circumstances.
Yeah.
So that's really a big topic which should not be underestimated. I would also now move to Tom, you know, and Tom, you are the male part in this round, so you are also the Siemens expert. So we would be all interested From Siemens' perspective, have there been specific challenges? I mean, we have heard, from MedTech, but we have also heard from other industries, for example, that also with regard to or due to COVID, the supply chain was a problem, you know. For example, assembling certain devices, you know, companies had to wait longer because they couldn't get the specific pieces from abroad or whatsoever. Did Siemens had some challenges regard to that? But also in general, how do you think does COVID-19 impact also the R&D side, for example, in MedTech?
Thank you for the question. I have to admit I'm not the expert in our supply chain. I, of course, heard about some challenges, factories potentially closing down to lockdowns, employees not able to go to work, and we found there are ways around it. Also there partially virtually, but in a factory, of course, you need to be there. And they got some special allowance or special access rights to still make sure that happened. So yes, there was, as I mentioned before, in the CT, for instance, there were a lot more demand for that. So we had to reschedule certain experts into other fields to make sure that that kind of demand could be responded to. Overall, I don't think there were huge challenges on the supply chain to that extent. It was a bit more in the testing environment, where, of course, and especially now also the fast testing, it's demand in an area that we typically did not have at all. So all of a sudden you get now huge demand for products and tests that half a year ago or a year ago did not exist. So there, of course, you need to reschedule. Dr. Waller also mentioned there, you need agile teams, agile colleagues to change their expertise and to be willing to do, or to work to do the extra mile for that matter. What we also saw is the engineers. If the engineers were in contact with certain patients, our engineers going to service, to sites to service our equipment, they of course come in hospitals where there is COVID and then they had to be quarantined, and then how to deal with that if all of a sudden your whole service engineers are stuck at home. Luckily there also we utilize already for a longer period these kind of virtual tools that you can remotely update the systems with software upgrades and updates. You can do it remotely to a certain extent, and then sometimes also get help from the hospital engineers to be the hands on the ground with the engineer working from home. So those were challenges that I know that within our organization had to be faced. Personally, of course, I'm more in the, let's say, in the sales roles there, developing these partnerships. All of a sudden, I had to cancel all my business trips. And typically, I was traveling 3 weeks out of a month. All of a sudden, I had a lot of time sitting at home. So that's initially that was a challenge for me personally. Then, how do I interact with my customers? As initially, the hospitals, those are mainly my direct customers, did not have the access to those tools as we have here today. So they didn't work with Zooms or Teams or whatever that was not installed yet on their system. So that was, in a way, a bit of a strange period that all of a sudden it became quite silent to that matter. Although the hospitals also came over those challenges. So I think we all managed that. And as I said in my previous speech already, I think this is changed for good. So in future, I don't think that I need to travel that much. I think it is possible to do it a lot more efficient and to improve the footprint there, because going for a customer meeting and flying all over the world for that actually doesn't make sense. And so far, the whole healthcare side, I would say that the doctors, let's say on the other side, said, you have to be here. I want to see you in person. And I think that everybody now is a bit more mindful that has changed, and has changed for good. So you can say, of course, and there are, and especially when I listen to the stories in Lebanon, that's of course devastating. I think there are also some good things out of the pandemic, that we might travel less for let's say purposes that have to be questioned if those really make sense. So I hope it answered your question a bit, yes. Although I'm not a supply chain expert within the organization.
It is very good. And you raised also a very important point, which I think refers also to a lot of women out there. You raised the point with the travel for business, you know, because we all know, I mean, many of us, including me, we traveled a lot for business. And the last year, I mean, my miles account has gone drastically down, but I don't regret that. I have to say, yes, it is possible. But actually, we have been talking many years before. Can we not make this meeting online with a digital tool? And there was always a discussion, and no, it's not possible, and so on and so on. Of course, certain meetings you should have in person, but in general, I think COVID-19 has shown us, yes, we can do, you mentioned some of them, Zoom, Teams, whatsoever, you know, to do it virtually. And I think this, to a certain extent, is also a benefit also for women, because with regard to the topic of combining childcare, for example, long business trips, you know, so nowadays you can do this in actually virtual, and it's to a certain extent also kind of a relief. So thanks a lot for that. Before I move on to another question, which I'm really interested in, I want to ask Gabi, do we have, and I'm sure we have, questions from the audience?
We have, and Anne-Marie is asking or / commenting, were pharma companies not too dependent on basic products from China?
Yeah, this is a very interesting
approach.
Who wants to answer?
Well, yeah, I will have to really comment that over the past years, the pharma companies moved to sort of subcontract manufacturing, or I mean, even we know that raw materials come from sometimes China or Asia to Europe and the United States. What happened, I think, because of the pandemic is that these pharma companies have realized that due to the pandemic, they couldn't get the products, whether finished or semi-finished, to Europe in order for them to actually do the final release or whatsoever as quick as compared to the other option of having them in the same country. And I believe that post-COVID is going to have more localization or even regionalization. This is going to be the trend, because obviously as a result of this pandemic, the world has paid, I mean, millions of cases, whether in deaths or in people who got sick. So definitely I see that the policies are going to change. And maybe it is going to be more expensive. This is going to be challenging, but definitely you cannot, you have to have self-sufficiency. And this pandemic has proved that this should be the priority for countries.
Thanks a lot, Hanan. It's a very interesting question, because it also, from a geopolitical perspective with regard to health, you know, as you touched it, Hanan, we had the global approach. Now countries actually recognized maybe that they are lacking some parts with regard to the pharmaceutical value chain, and they want to actually bring it back into their countries. So this is a really broad discussion, which would actually fill a whole afternoon session, a new one in the next weeks. So are there any more questions, Gabi?
There's just one more comment from Anne-Marie. Was this a matter of cheap prices, but we need quality products? So that goes a bit in your direction, regionalization and perhaps a shift. Please,
may I comment on this? Shifting the manufacturing to China or any other country does not really compromise on the quality of the product. This is because the pharma companies, they actually give the direction, and they audit and they supervise all the steps that are ongoing in the production, whether it's in China or any other part of the world. Whenever you have a product which is produced in another country, it will be under the supervision of the mother company, say Pfizer or Merck or whatever it is. It will be under the license of these companies, and the final product would go back to these companies for them to actually release the product. So they would be doing the final quality control on these products. And from an economic point of view, definitely the facility of these multinational or pharma companies, they would like to free their facility for the production of new drugs that are coming to the market that have, rare diseases, chemotherapeutic agents, blood products, all kinds of products that are new, that have tackled actually new diseases and allowed the humans to live longer. So it's not, I would like to make it a point again that it is not a compromise on quality, whether it's coming from China or elsewhere. Now the problem is becoming, no, we don't want to have a disruption in our supply by having the products produced in another territory. We'd rather have them in our own territory so that we actually satisfy the need. I don't know if this made things clear.
Very much so.
I found this answer really very actually good, and it covered the big topic in general and the quality aspect which you raised. Maybe if I can hand this question also quickly over to Tom, because Siemens is also a global player. Do you have an opinion on that? I mean, from as I said, Siemens is globally active.
Yeah, and in terms of production, we of course also produce a lot in China. And I do believe that it makes sense that for the Chinese market, for instance, it will be developed, and the research and developed is done also locally. So I also believe that it will be more local from production point of view. Yes, of course, quality-wise, this is strongly overseen by let's say the central organizations, but I think. So therefore, I don't see the issue of the quality there, at least not in our organization, and I do even see it as a benefit that we have this local production, that they are closer to the market, local to the demands there, and not so much, for example, German or American engineers designing products for a market that they are far away from. So in that sense, it's better that it's being done locally. Yeah, so to that extent, I believe in that diversity. At the same time, we need to make sure, especially when it's in healthcare, that the quality is ensured.
So there's another question directly to Tom from Anne-Marie. How convince elderly people who are not so used to the modern facilities, a lot have no mobile phone or can't use it, how to embrace them, how to include them, how to attract them?
Make life easy for them. Huh? So I'm with you there. I think it is not as easy. That generation is not so used to the smartphones. And I remember that my grandfather had a huge telephone to simply dial my mom first when something that was already 20 or 30 years ago. It is, of course, a bit more difficult to bring them on board. At the same time, I do believe that one of my customers once called the new hospitals will be called homestables, in a way that homes will be part of the hospital. And I also think towards elderly people that we have to work more with simple versions of telehealth. So not too complicated devices for them, but that they also get a part of the care from home. And that's up to the industry to make it as simple as possible, also to include that part of the society. And for especially acute care, they still have to go, of course, to the hospital, and that is something that will not change. I think if there is a certain heart impact or something, they have to go to the hospital. So for those kind of services, it doesn't work, it doesn't help. But if we look to this, for instance, patient monitoring, what we do with heart patients, it's relatively easy. They have a weighing scale where they have to stand on. They have to put a band around their arm for blood pressure. And automatically this will be uploaded into the system. So in that sense, yes, you have to educate them and explain this maybe a few times more to them, but we have to keep it simple. Otherwise, it will not work.
May I comment? I don't know if I can. I mean, we have at the American University Hospital, we have courses that are allocated to senior citizens, and I think this have proven to be very helpful in a way when you get the elderly people to attend maybe webinars, maybe after things get better, for them to go somewhere whereby you have a lecturer or someone who is specialized in a particular field to sort of give them direction. This way they will remain engaged, and having a group of them together, I think it stimulates in order for people to remain engaged. I mean, look at us. Now we are discussing the digital and what's going to come next. So I believe that a human being cannot but be open to developments that are coming. So we need to remain having an open mind. And I think that embracing the elderly and putting them in such an environment might motivate them and stimulate them to stay in touch. It takes the family as well as the community some kind of an initiative to attend to this, because at that time I think their life would be more enjoyable and they would be more satisfied.
Yeah, this is a very good point, Hanan, and I'm very happy that this question was raised, because it's really important, you know, when we talk about digital, when we talk about digitalization in healthcare, artificial intelligence, robots, virtual reality, I always say we have to bring everybody on board. So this really includes everybody, from the young to the senior ones. And I just can give you a personal insight from my experiences. In my book, I describe actually how does artificial intelligence work, but I describe it specifically also for elderly people in an easy, non-technical way. And the feedback I got was, wow, this is really interesting, and also to understand now not just AI as a buzzword, which we can read every day in the media, but really where is it implemented in when I go, for example, to a hospital, and what does it mean to my data? And I really can say that a lot of people, I mean, this is also a definition question, from which age on are you considered to be old, you know? I think the younger ones here would actually already say that I am old, you know? So it's important to bring here everybody to the table and to explain, because the consequences are really massive when it comes to digitalization in healthcare. But there is also tremendous positive effects, as we would have heard now from all actually the panelists and the guests today. So, are there any more questions?
I think I would like to add to that. It's a very interesting topic when you think about digitalization in healthcare. And as you're saying, how do you make it inclusive so that it does not include the digital divide? So yes, elderly are only like one group of the people who are a bit excluded. But then you also have people in the rural areas, you have people with low literacy, low digital literacy, low healthcare literacy. So how do you actually take all of those people into consideration to, you know, there's not actually, when with digitalization, you don't really increase the inequalities that are already present. And the tech community, a lot of them are of the younger age, are completely excluding like the senior people out of design. And now, interestingly, you have a lot of courses and a lot of focus on how do you design tech for elderly people, because I think a few years back you say, okay, we'll design this app and for care, and then you will have, I don't know, his daughter, her son would help them with calling a nurse. But more and more senior people want to actually be independent, and it's their right to be independent, and you have technology that is designed to help them become more independent.
Yeah, that's a very good point. And we also, I mean, with regard to the inclusivity, we need to bear in mind not everybody can afford all the digital tools, you know. And it's also important to have like the kind of digital education, what I call it, when it comes to healthcare. Having said that, Yara, I would like to pass the question already back to you, because you just raised the topic. Looking a bit now, we have talked a lot now about the current situation with COVID-19 and so on. So I would like to look in the last minutes we have a little bit towards the future. So as I said earlier, I mean, you cover a lot of countries and regions. So if you have like a wish free today, you know, what would be your hope, your wishes, but also your expectations from a future healthcare system changed maybe to the better because of COVID-19, and maybe also with specifically tailored with benefits for women in healthcare? Do you have there any kind of ideas or hopes?
Yeah, I think it was just exactly what I was saying earlier, inclusivity.
Yes.
How do we have healthcare that is inclusive for everyone's needs, senior people, women, and how do we have, starting from gender disaggregated data that realizes the differences between men and women and start tailoring the digital solutions that are available for women's health needs. So accounting for the differences, the difference in understanding the symptoms, the difference in treatments, the difference in delivering the treatments to women and men. Right now, what we have is one solution fits all kind of thing, because I think specifically in the region, we're kind of still starting with the digitalization, so fair enough. But as we go forward, how do we build on the promise of digital health for super personalization? That's what basically the best promise of digital health is, that it's going to provide personalized solutions. And the other thing I would say is the continuity of care. So how do we just like from the beginning of you know, monitoring and prevention, continuing until the treatment and follow up without having, you know, to go through different places, different forms, different tools. Yeah, I think that would be my wish for the future, which I hope is coming soon.
Thanks a lot. Passing this over to you, Tom. What are your expectations, your wishes? Do you have any? I mean, maybe you say,
wow,
status quo is perfect.
No. I think, as I said before, there are also some good things out of this pandemic that we should keep. What we should make it easier, I think, is the whole data protection. I think, especially in Germany, data protection is a huge thing that is maybe very relevant, but also slow down a lot of implementations. I think also there's still a lot of bureaucratic in the whole healthcare procurement systems. So if I look to Africa, where there's a lot of demand for new hospitals, for new developments, also bring their digital solutions, especially when you see remote areas there, people might not have access to healthcare. And there are also all kind of bureaucratic models and procurement models are simply slowing down the need that is there. So we are also, as Healthineers, quite active in these kind of PPP models, so public-private partnerships, and there we see so much bureaucracy, and that is simply a waste of time. So if you ask me, what is a wish? I would wish that bureaucracy could be less, and we can help faster, let's say, because we see the need. I'm not sure if you ever been to the African hospitals over there. It's not a place that you want to be when you're sick or when you have COVID, for that matter. So therefore, in my view, there's still too much bureaucracy in these kind of procurement rules and procurement models. What else? What kind of wishes I would have? Let me think about it. I'll come back.
Thanks a lot. Hanan, in the meantime? I mean,
well,
it was really
I think with what's going on regarding the medications and the research, the ongoing research has actually prolonged the life of an individual. And so in my mind, I don't think that we can ever overlook the fact that we will have to take people like elderly into consideration. And to that matter, I think you can all the time devise and program some kind of, I mean, whether it is let me say, aids, okay, to help the elderly access certain issues of or aspects of life or whatever it is through digitalization. So I don't think that we can afford to overlook any part of our society or any part of the population in general. On the contrary, I think that this presents whether you design things that are special to elderly or people with limited, who have special needs. I think this brings an added value. So, and inclusion on top. So I don't think that this has to remain on the top of our minds to really cater for this. We cannot afford to overlook any proportion of our society.
Thanks a lot, Hanan. These were very nice summarizing words. Gabi, do we have some more questions from the audience with regard to that?
Not now, thank you.
Okay, perfect. Then we're coming almost close to an end. You know, we have some minutes left. So I would also say that I much appreciated today this discussion. It was very insightful. It was very diverse. We touched a lot of topics. We all have seen that the whole topic of COVID-19, digitalization in healthcare, women fighting the pandemic, it is almost too much to talk about, so then to cover it actually in 2 hours. But we tried our best, and we hope that you as an audience got a lot of good ideas and answers to your questions. And I'm sure that Gabi will organize actually a follow-up session in particular on that topic. Having said that, I would like to give the floor for a last final statement to each of our panelists. You know, whatever you want to say, is there a recommendation to our audience out there? Is there something you just wanted to say with regard to the topic? We would appreciate a short final statement from all of you. Wala is not here anymore. She has unfortunately already left. Yara, maybe from you.
I was reading one of the questions in the audience on how can we bring more women into the development of AI, and I think it's one of the most inspiring things, as I was saying earlier. Like, how do we bring more women into STEM? So the whole technologies, and specifically within the health tech part of it. How do we do that? I don't think we can talk about that in a couple of minutes, but I think it's one of the most pressing things that needs to happen.
Thanks, Yara. That's a good topic for one of the next sessions.
There will be one, to be sure.
For sure.
Well, I think there are 2 issues that come to my mind. First of all, now pursuant to the pandemic, a sense of awareness is projected on the digitalization, but more efforts have to be actually allocated in order to make this topic as a priority, whether it is in universities or wherever, even in the workplace. For people to become more aware on the necessity of this, and on top, actually, the advantages that were mentioned by Tom earlier regarding the efficiency, whereby you don't have to travel anymore for conferences, which means this translates into quicker decisions. So you would hold like a Zoom call or whatever it is, discuss all the aspects and come up with a recommendation. I don't think we can escape this. It's coming, and I believe whoever jumps into the opportunity and starts creating this at whatever level so that it grows, it will be appreciated, and it will be like a snowball. It will pick up in different directions. Another point that I would like to really raise associated with the pandemic is that women have proven to be frontliners. I mean, this is something which cannot be overlooked by any means. Whether the nursing, whether the pharmacists, whether the doctors, wherever they were located, they have brought more value. I can cite for one that when the explosion took place in Beirut port, a video was taken of a nurse who actually grabbed like 3 babies, newborn babies, and walked in the hospital to take them to a safe place when everything was destroyed around her. So for me, this has actually made us visualize that women is a topic concentrating on women. It is a vital topic, and by all means, we should be allocating our efforts to empower them and having them more and more of inclusion into our systems. I mean, this catastrophe actually reminds me of an association with the financial crisis which took place in 2008, and there was a study that was done pursuant to that on banks that suffered less, and it was found that banks that suffered less had more women on their boards. So, I mean, this wise decision, maybe if we had in leadership, for example, in one of the countries, whereby one would think, well, what if a pandemic takes place? Then we should be localizing our supplies in the country rather than having to access them through different territories. So, I mean, these are the thoughts that come to my mind. We cannot overlook them at all.
Thanks a lot, Hanan. Very nice summary. Last but not least, with the please spare a quick answer so that I can still hand back to Gabi. Tom?
A quick one. I seem to be last every time, but I'm happy to be in the healthcare world. And I came from the energy, and as you said in the introduction, 2012, I came in from the mobility side, so the transportation, where I think it was Dr. Walla who said that women in healthcare is actually a sector where there's quite a lot, compared to other sectors, quite a lot of women working in this sector. And that's actually also not only the fact that in healthcare you do something good for the society, also the fact that I work in my company with quite a lot of women, and the topic of inclusion and diversity is high on the agenda. And that is something I really appreciate. Unfortunately, we still need that. I hope in a few years we don't need this kind of extra stress on this topic and everything is equal. But okay, life is not always like that. But I do highly appreciate working in very diverse teams, and that includes also working in my work quite a lot with women, and which I highly appreciate it, as also today's discussion, where it's also not equal. I'm in minority here, but I hope that in future that things get more equal there, because I highly appreciate the contribution from women.
Thanks a lot, Tom. Very nice words to the end. I want to thank all the panelists. It was really great exchanging with you. And I'm looking forward to actually go on with that discussion. Having said that, I would like to hand over to Gabi.
Yeah, thank you so much, Nicole. Thank you all for this amazing session. What a high profile and eye-opening and inspiring discussion that was. Thank you so much also. I was really touched by your openness also, sharing a very personal expertise, which made this exchange so very powerful and special. So we are truly indebted to all of you, our excellent moderator, Nicole. Thank you so much. Wonderful speakers and utmost engaged participants, again, as we've been saying, who've been joining us today from all parts of the world. So for me, what is my takeaway? For me, it was both inspiring and a call for innovation, a call for partnership, to join our efforts to find practical, inclusive, and sustainable solutions to the pandemic, as well as to future global challenges, because this might not be the last one. And here my wonderful granny comes in again. By the way, she was so capable and a true passionate person when it came to digitalization at her age. I still remember her sitting in front of her laptop trying everything. So yes, also elderly people can be embraced. And she, as she was saying, health is everything in our world. So thank you so much. Have a nice evening. Thank you for joining. Thank you for joining GAWBL family. Stay safe and stay healthy. Thank you so much. Bye-bye and see you very soon.